Good morning, everyone. As of today, we are at 221 confirmed cases in Baltimore City, an increase of 168 over the last 70 days, 168 over the last 7 days. We really need everyone to stay home, period. Every time you leave your house, you put yourself and everyone in your household at risk, not to mention all of the people you come in contact with once you leave your home. We need all residents to do their part and stay home if you do not need to go out for one of the essential reasons. The number of confirmed cases in the state and in the city increases daily. You have heard all of the healthcare professionals talk about flattening the curve. Right now is our time, Baltimore. Right now is our time. This is our chance to save our city. If we flatten the curve now, we can prevent our healthcare system from getting overwhelmed in a few weeks. I just can't stress this enough. Staying home is literally saving lives. And on a similar note, we know that we're facing a very tough budget outlook for our city. I speak every day with the county executives from the state's largest jurisdictions, and we're all experiencing the same budget challenges. None of this was anticipated. As soon as we understood the new budget realities of less revenue, I made the decision to communicate directly with the public. That's why I ordered a spending and hiring freeze that began last month. A lot of this is uncharted territory. We don't know how long this will last or what our budget will look like once the dust settles. I'm going to be open and honest with the people of Baltimore about our challenges as relates to the budget. Now I will turn it over to our finance director, Henry Raymond, and budget director, Bob Cinnamon, to provide additional information. Just put it on top.
Good morning. I'm Henry Raymond, Finance Director. I've been joined by Bob Cinnamon, the Budget Director. As you are all aware, the city has been significantly impacted economically due to the COVID-19. As it relates to the current fiscal year, fiscal 20, we've had to write revenue down and through the mayor's leadership impose a freeze to curtail spending so that we can focus on the core priorities of the city. As it relates to fiscal 21 budget planning process, we've submitted the preliminary plan this morning, and that preliminary plan will be subject to extensive revision, again due to the economy, where we're looking at reducing the general fund revenue and expenditures by approximately $103 million. This is largely due to the economic events of the shuttering of businesses, establishments, retail, hospitality has been negatively impacted, etc. The budget director will provide more details, and I'll ask him to come forward.
Hi, good morning. Thank you, Henry. So this morning we provided a little bit more detail to the Board of Estimates about both the outlook for fiscal 2020 and fiscal 21. So just a bit more detail. We've written down our fiscal 2020 fiscal year forecast, which is the year we're in that ends on June 30th, by $68.7 million. And the reason for that is some of the items that Henry mentioned. We're seeing sharp declines in all of our transportation-related revenues, things like parking fines, garage income, traffic camera income. And excuse me, we're also seeing on more of the tourism and visitor side of the budget, we get significant revenues from hotel tax, from convention center business, from admissions and amusement tax, and all of those things will decline as those activities have slowed. We also expect lower income tax revenues. Income tax revenue, of course, is driven by people working and people being employed and earning wages. And as we see more people filing for unemployment, we expect to see declines in those areas. So that would leave us in the end of the year, by the end of the year, in a deficit position. But as the mayor said, we've put in place a very strict freeze so that we're only spending on really core essential services for our citizens. For fiscal 21, we presented the budget today to the board. As the crisis escalated over the course of March, we were actually putting the finishing touches on the preliminary budget that we had planned to release. And unfortunately, there was not enough time to make significant revisions before the budget was released today. So it will be published today. You'll be able to see it online, but the big disclaimer is that it's largely irrelevant because the economic assumptions are going to change so significantly. So we're working very quickly, myself with Henry and the mayor and his team, to make revisions and make additional decisions for the budget, the final budget that needs to be introduced to the Board of Estimates, which will be on May 6th. So happy to take any other questions, either me or Henry, on the fiscal outlook. Thank you.
One of you answered the question of whether you are.
Yes. Thank you both for all of your hard work during this difficult budget process. In the midst of some extremely challenging times for our residents, I want to highlight some of the good deeds that are providing us with some hope. I want to take a moment to thank some local businesses who have pitched in to help and have switched their operations to making much needed hand sanitizer. Old Line Spirits, Baltimore Spirits Company, Sagamore Spirit Distillery, and Charm City Medworks, in partnership with Mount Royal Soap Company and Wavy Color Company. And I also want to thank the hundreds of residents that have called and emailed during this time of crisis, asking how they can help and what can they do for their city. That's the Baltimore we all know and love. When times are tough, we roll up our sleeves and ask what needs to be done. And by taking care of each other, now we will come out of this stronger than before. And part of our strength will depend on every resident of Baltimore City being counted. That's right, today is a very important day for the city of Baltimore. Happy Census Day, Baltimore. I know I've been talking about it for at least the last 6 months, but the day is finally here. The number of people counted in our city will affect you, your family, and your entire community. So let's make sure we all get counted. The census is easy and it only takes 10 minutes to answer 9 questions. You can respond online, by mail, or by calling a live person. The census directly affects federal funding for things like this public health emergency we find ourselves in now. Federal dollars reserved for feeding children and older adults are essential to providing food relief during this crisis. It is critically important that we count everyone in Baltimore City today. For more information, visit my2020census.gov or call 844-330-2020. Again, my2020census.gov or call 844-330-2020. Now I'd like to ask Stephanie Smith with the Department of Planning to come forward and offer additional remarks.
Thank you, Mr. Mayor. We've heard some sobering information about the fate of our budget and, of course, the fate of our fellow neighbors as it pertains to COVID-19. And you may wonder, what does that have to do with the census? It has a lot to do with the census. There are many programs that we're relying on with federal funding that are dependent on formulas that look at census population numbers. So the investments that we're making in the people of Baltimore are based on the counts that we made in 2010. Now, I want to tell you a quick story. In 2000, we did not do a very good job on the census. That's a fact. But we had a comeback story, one of the best comeback stories for a city of our size. And in 2010, we improved our response rate by 6 points. And this year, we're in a challenging time. But it's still an opportunity for us to further count every neighbor that we have so that we can get our fair share of federal dollars that make sure that we can feed the most vulnerable in a time like this, that make sure that our seniors get the support they need in a time like this. So the census is actually really important to the times we're facing right now. And one of the things I want to lift up is that we've been told by our mayor, we've been told by our health commissioner, and leaders across the country to stay at home, to stay with our families. Well, that's a perfect time to look around and count everyone in your home and participate in the census. You can actually be a hero for your city by staying home, picking up the phone, or logging in and counting everyone that lives in your home. But I want to remind you, it does not have to be simply the person you're related to. Every single person who lives in your home must be counted on the census for us to get our fair share. It doesn't have to be the person that always picks up their socks. It doesn't even have to be the person you like. If they live with you today, April 1st, they are a part of your household and they need to be included on our census. I just want to thank everyone that's doing all that they can to try to stay focused on moving our city forward. And this is one way every single Marylander and every single person in Baltimore City can do so. So thank you.
Thank you, Stephanie. Any questions? related to general questions.
Just on the Baltimore City cases, the statewide death number really jumped from yesterday. What's the coronavirus deaths number in Baltimore City as of this morning?
So for Baltimore City, it's 3. Yeah.
It remains in three?
Yes.
Provide an update on the future care facility and what the city is doing to make sure residents are taken.
Yes, so as of yesterday, there are 5 confirmed cases at the Future Care in Cold Spring. The city is working, and by the city I say Baltimore City Health Department, Fire and EMS is working with the Maryland Department of Health as well as our local healthcare and hospital partners to ensure that that center has the wraparound support services that it needs. The health department will conduct contact tracing just as it would with any other case to ensure that we understand who those folks may have come in contact with.
Are those cases of patients, residents, as opposed to staff members?
It's a mix of both.
And is anyone hospitalized?
There, we do have 2 that are hospitalized.
What is the protocol that is supposed to be followed? We have really heard kind of all over the map about the level of personal protection that's being
Yeah.
utilized in these kinds of facilities. What is the standard these days?
So the standard protocol is what we call personal protective equipment, including your N95 mask and a full gown, as well as a face shield.
For everybody that works in these facilities?
If you're concerned that the person has COVID-19 or has symptoms of COVID-19, yes.
After the outbreak at Future Care, is anything changing in how you're dealing with cases there and at other similar facilities?
So again, we'll continue the work that we're doing with our partners to ensure that if we're seeing a spot where there are multiple cases, that we're fully doing a contact investigation and that we're providing them with additional healthcare resources. Again, that's where our hospital partners come in if that's needed.
Now, are there other facilities that are residential facilities that have confirmed cases that you're working with?
Yes.
There are other
Mhm.
facilities like that?
Yes.
Can you identify them?
Levendale.
Do you know how many cases?
Yes, 3 cases, and there are some that are pending results as well.
Is that a mix of staff and residents or all residents?
Those are a mix as well.
Are there any of them hospitalized?
That I'll have to check back on.
Mayor, $43 million deficit, $68 million loss of revenue is pretty significant. Is the city contemplating layoffs of city employees at this time?
Well, we haven't contemplated any layoffs right now. I'm meeting with my budget people this week. I think it's Friday to look at all of that. As you know, if we don't have revenue, we have to have everything have to be on the table. But I keep saying that the president, Mr. Trump, needs to bail out cities. They're bailing out large corporations, but no one is talking about backfilling cities in terms of lost revenue from conventions not being able to take place, like Mr. Senemy just outlined. All those things are revenue sources that we will no longer have. So we have to be realistic and tighten our belts. I personally don't want to see layoffs, but if the budget dictates that, we have no other choice unless our president send us some relief. Not just Baltimore. Our surrounding counties are facing the same issues that we're facing. Lost revenue because people are not moving. We're asking people to stay home, and just essential workers are out performing their duties to keep the city moving. Someone said the city was shut down. The city's not shut down. Basic city services are being delivered. So I'm hoping that our president is listening because bailing out banks and major corporations and forgetting cities that actually do the work on the ground, we're where the rubber meets the road, and we need the help. And I'm calling on our federal partners to come up to the plate and help cities like Baltimore.
How about the question of a tax increase? Is that on the table?
We haven't. I haven't met with my finance people yet, so I can't answer that right now.
Anything else? All right,
Mr. Mayor,
last one.
can you address the police involved shooting earlier this week? The officer involved had 4 other shootings.
Well, I was there, and I'll defer to the police commissioner because this is an active investigation.
What's the question, ma'am?
Is there concern with the officer involved had 4 other criminal involved with this one? Is there concern that he should still be on the street and not pending this investigation?
Well, this one is an open investigation. It's an internal investigation for a police-involved shooting. The research that has been given to me was that the other incidents, which were years past, were all ruled as justified. And so right now, since I have been the police commissioner, this particular employee, among others, have been to our new use of force training, have been to the new stop, searches, and arrest training. And so we have, in this administration, delivered the best practice training to our officers, to this officer specifically. And so right now, we wait for the outcome of the investigation.
Is there body-worn camera video of the shooting of this individual?
There is, and I have seen it personally.
Does it corroborate the story that has been provided by the police department?
It's an active investigation. It would be improper and almost unethical for me to say that now. What I will say is that I have seen it personally. At the press conference that night, we implemented our video release policy, and we will follow that policy and be releasing the video in the very near future.
Thank you.
Thank you.